In this video, we discuss heterotaxy syndrome. It is also called Sachs ambiguous. There is a disturbance in the usual left-right distribution of the thoracic and abdominal organs. There is no entirely corresponding to the complete mirror image like in Sachs inversus cases. It is due to an early embryological developmental disturbance. Most cases are sporadic. 20 to 25% are associated with the immotile cilia syndrome, including cardiac syndrome. Clinical presentation is dependent on severity of the isomerism and presence of associated abnormalities. Cyanotic congenital heart disease is the main presentation in right isomerism. Left isomerism tends to present later in childhood or even in adulthood since it is less associated with complex congenital heart disease. Intestinal malrotation with midgut volvulus may also be a presenting feature. Bronchial anatomy accurately reflects atrial Sachs. In hyparterial bronchus, below artery, which supplies the bilobed left lung. In eparterial bronchus, alongside the artery, which supplies the trilobed right lung. When considering radiographic features, there is duplication of the left or right-sided intrathoracic contents with associated changes below the diaphragm. There is malposition of the liver, stomach, and spleen, which may be absent. The vascular supply above and below the diaphragm may be altered significantly, including SVC duplication. In left-left isomerism, it is also known as polysplenia syndrome. You can see multiple splenules without a parent spleen, azygous or hemiazygous continuation of the inferior vena cava, bilateral hyparterial bronchi, bilateral bilobed lungs, bilateral pulmonary, and left atria, midline or transverse liver and intestinal malrotation. In right isomerism, it is also known as asplenia syndrome. You can find severe cyanotic congenital heart diseases, absence of spleen, bilateral eparterial bronchi, bilateral trilobed lungs, bilateral right atria, midline or transverse liver, intestinal malrotation. A minimal radiological workup should include chest radiograph, echocardiogram, to assess for congenital heart disease, abdominal ultrasound, to assess intra-abdominal contents, especially spleen, upper GI series, to rule out malrotation. The mortality rate in the first year of life is about 60% in polysplenia and 85% in asplenia syndrome.
If you like the video, you can like it, comment it, and share it with your friends. If you are not subscribed yet, please subscribe and click the bell button.